Panning rain. Alright. You ready?
Alright, I'm Bradley Holmes. I'm a student nurse here at PRCC, and what I'm going to tell you today is going to take longer for me to tell you than it's actually going to take to do. It's an effortless, cheap way to cut down on the growth of antibiotic-resistant bacteria. Since penicillin was first tested on humans in 1941, antibiotics have been the seemingly closest thing we've had to a cure-all. But in recent years, as early as 1960, there's been antibiotic-resistant bacteria such as MRSA. MRSA is methicillin-resistant Staphylococcus aureus, which is the most infamous that we know of, a lot of, and while it hasn't been a problem until recent years, now up to 7% of all people in the hospital are colonized with MRSA. For the protection of public health, especially those in the hospital setting, including us as nurses, we really need to control this. We need to control the growth of these new superbacteria. There are many categories and subcategories of antibiotics, but they all have a similar function. They all interfere with the synthesis of at least one bacterial component. And saying that what doesn't kill you makes you stronger is maybe an exaggeration, but it's mostly true. And this applies to bacteria too. When the bacteria aren't destroyed by the antibiotic, they survive and become the new dominant bacteria. These bacteria do not have to compete with other bacteria that have now been eliminated, and they can replicate more easily. They can multiply and evolve and build up immunities. They carry this immunity and an extra set of DNA called plasmid. And they share these plasmids with other bacteria, so even if this other bacteria hasn't been exposed, they are now resistant to whatever they've evolved. They can change this DNA, they can replicate it, they share it, and they change the way they synthesize things, which is how they bypass the target of the antibiotics. But antibiotics have no effect on viral infections, which cause the influenza and the common cold. Just recently, I went to the clinic for a respiratory infection, and they tested me for flu and strep because I had symptoms of both. And no other tests were done. They gave me a prescription for amoxicillin just because they couldn't figure out what it was. They weren't going to test it anymore. And at least 150 million antibiotic prescriptions are written annually in the United States. And the CDC estimates that at least a third of these are completely unnecessary. They're just there for the field of safety for the patient. And each one of these prescriptions is a potential for the development of antibiotic-resistant bacteria. The risk of resistance is increased whenever the antibiotic is misused. If the antibiotic is effective against the pathogenic bacteria, the symptoms will be alleviated, because once the majority of the bacteria are gone, if they are the problem, the apparent ailments will be lifted. But even if a majority of the weaker bacteria, which is going to be the first ones that are wiped out, even if they're wiped out, the stronger bacteria may remain. And if the person feels better and they just decide they're going to stop taking the antibiotics since they feel better now, and they're going to save it for later, it's not going to be effective the next time, because these new stronger bacteria are going to become the dominant organism in the body. And the next time the person tries to use this antibiotic, it's not going to be effective. So while we can't do anything to change the number of prescriptions written, and we can't deny that the antibiotics are useful, a very simple and economical way to reduce this problem is simply using the antibiotics properly and efficiently. As I mentioned, the risk for resistance is increased with misuse. As individuals, alone, we can protect public health just by taking the antibiotics as prescribed. And as nurses, we can educate patients and others to take the full course of antibiotics, even if they're feeling better. Because I know that I've taken several antibiotics, and I know that as a patient, I've only been told by the doctor once that I should take the full course. He actually explained exactly why and told me, he laid it out that I should take it even if I'm feeling better. And taking a little time and effort to increase the compliance is the key to saving a lot of time and effort in the future to combat future generation of bacteria that are resistant to everything. So while we're limited in options as individuals, public health begins with the individual health. So the more individuals that comply, the less we'll suffer from this emerging threat. Any questions? Thank you for your time.